Friday, everybody. It's another gorgeous day here in Gilbert, Arizona. Just getting to the clinic here. Gonna get underway for Fridays at RP. Today we have 2, possibly 3 procedures. We might have a stellate ganglion block this morning for a patient who is suffering with some anxiety and chronic pain. And then that one's still up in the air though. And then we've got an interesting knee case later too, actually bilateral knees. And so we got that. And then we have TMJ pain and tracking issues. Sorry, there's a big truck over there. Tracking issues that we're likely going to treat with some prolotherapy and some perineural injection therapy. So let's get this day going, everybody. Happy Friday. So the fat pad has a lot of stem cells that act locally, and so it helps with healing of the patellar tendon. It helps with healing of the meniscus and the ACL. And so when I have a patient who either has patella tendon issues, or they've got a meniscus issue, or an ACL issue, or even just osteoarthritis of the knee, that's where I include, especially treating the infrapatellar fat pad. The suprapatellar fat pad I don't treat as often because there's not as much research showing that the suprapatellar fat pad has a metabolic physiological function other than an actual shock absorber and sliding surface, whereas the infrapatellar fat pad has a ton of that. Because of that pain that she gets in that loaded flexion position, there could be some fat pad impingement up there as well. So that's why on her I treated the suprapatellar fat pad.
When you say metabolic function, are you meaning like the stem cell function that you just talked about?
Stem cell, yeah. The fat pad is a huge metabolic. It's an organ. It actually produces cytokines, growth factors, all this type of stuff. And so when it's dysfunctional, it can actually push healing in the opposite direction.
Okay, so I'm assuming it has a lot of blood flow then, or
yeah.
Okay.
It's pretty well vascularized. There's a lot of nerves in the area and stuff too.
That's why it hurts when you inject it.
Yeah, that's why it hurts when you inject it, because all the nerves that are in the area. Yeah. All right, everybody, so we just finished up our 2 procedures for the day here Fridays at RP. The first procedure in the intro, you heard me talk about the first procedure, didn't work out to get on the schedule, but we had 2 procedures. So first procedure, we did bilateral PRP for the knees, or I should say PRP for bilateral knees. This athlete, high-level athlete, was having some issues in a lunge and squat pattern, especially under load. And so the one thing I wanted to talk about with this case is that it's sometimes really difficult with high-level athletes who move a lot of weight, not just their own body weight, but their back squat, their deadlift is really heavy. And we have a hard time sometimes eliciting the pain under a normal physical exam, because what you think about is our physical exam where we're doing orthopedic and muscle tests. Usually the patient's in a non-weight bearing position and then I'm applying a load to their joint or something like that. An example is testing the quadriceps muscle. So knee goes bent, I test the quadriceps muscle, I try to push their heel to their butt and they try to kick out. Sometimes the patient may have pain in that range of motion during a squat, but it doesn't come out when I do it. Now, it's important to not dismiss that and think, oh, that just means that that those structures are not involved. You have to think that, okay, well, this doesn't happen until they have a loaded barbell and they go into a squat or they catch a press or something to that effect. And then, we just have to be cognizant of what things in their life, in their activity causes them pain, and then trying to recreate that as much as possible with the same load parameters, maybe the same speed parameters, all this type of stuff. So that way we can effectively figure out what's going on and try to treat it. And so for this patient, we under ultrasound, we found a small tear in the quadriceps tendon with some what are called bone spurs on the patella. So basically, when you have a tendon that is over pulling on a bone, you can actually get outgrowth of that bone. That outgrowth is called bone spurring, and that can sometimes be painful. It's not always painful, but sometimes it can cause inflammation and degeneration around that area, which can be painful. And so we treated that actually on both sides, the bone spurs on the superior aspect of the patella. The side that is most problematic for her, there's a possible chance for what's called a chondral defect. And so basically there's a portion of the bone on the femur that has a defect in it from wear and tear. And so we did a super concentrated PRP. So normally our PRP, we're gonna average between 4 to 6x in our platelet concentration. And so with the spinning method that we do, our ultimate goal is actually to increase the concentration of platelets. So that way we take this much blood and we condense it down to this much PRP, which then has a lot of the platelets still left in it, giving us a PRP between 4 and 6 times the concentration of the baseline platelets. And what's most important actually is not just the fold increase that we get, but actually that we're getting a baseline minimum of numbers. And that's why we actually test our samples to know that, which not a lot of clinics do, FYI. And so for this case with the chondral defect, what we actually wanted to do was get an even higher concentration. And so the processing ends up being a little bit different. Our spin speeds are slightly different, and we use a lot of volume to get a very, very small amount of PRP that is going to be really, really concentrated in platelets. And so with the processing I do, it usually hovers around 25 to 35x. So big difference in the 4 to 6. So we did that inside the joint, and then we also did some nerve hydrodissection with the platelet poor plasma and some dextrose, and basically a very comprehensive treatment for the knee joint. So we're excited to see how that patient does. Our second case of the day was some instability and pain in the temporomandibular joints. Now, generally, I actually don't do a lot of prolotherapy, PRP, even stem cells for the temporomandibular joint. And the reason for that is that a lot of the times the pain from TMJ is not actually instability. A lot of it is actually the nerves in the area, mainly like the auriculotemporal nerve. The great auricular can also kind of be involved in that pattern. Sometimes the temporal branch out the facial nerve is involved. And so a lot of times other docs will go in and they will prolo the joint just because it's tender to palpation there, but not realize that that tender to palpation is usually actually the nerves. Compared to when before I started doing the perineural injection therapy, TMJ pain, I would prolo it. That's probably down about 90%. So only about 10% of the time do we actually need to do a prolo or PRP for the actual temporomandibular joint and the joint capsule and supporting ligaments. Now this patient, this is actually our second treatment. Our first treatment was PRP for the actual joint and the ligaments, and the second treatment was prolotherapy. And so for her, the reason we did that is she actually has a trauma to the jaw that has resulted in instability. And so before our first treatment, when she would open her jaw, she actually had a lateral tracking. You could feel it and you could see it. Her jaw would deviate because she had lost some of the stability in the ligaments that help glide, and the muscles as well, but that help glide the jaw when you open it from the TMJ standpoint. And so she no longer has that deviation. So our first PRP treatment resolved that deviation, but she still has some pain, a little bit of clicking, and a little bit of instability, but nowhere near what it was. And so we just repeated today with prolotherapy. And then again, the nerves around the area were a little inflamed and tender. And so we also treated the nerve. So again, super excited to see how that healing goes. But that was our day, people. It was super awesome. We had a whole bunch of students here. I think we had 3 naturopathic medical students here observing and helping, which is always great to help with the teaching aspect. It was just a fun day. I hope you guys enjoyed. Leave a comment, subscribe, like, do whatever, share with your friends if this might help them with their chronic pain. See you later.